Okay, well, what kinds of things was MCHR instrumental in achieving through its, occupational therapy committee or occupational health and safety?
Well, what we've done is we've turned on a lot of workers and med students to the issues, and we set up a committee like this Chicago Area Committee for Occupational Safety and Health. We set up one in Pittsburgh, which is functioning. We're starting one in St. Louis. We'd like to do a number in L.A. And we have people who are tied up with MCHR doing this kind of work in New York and New Haven, and we have good relations with other organizations. They're doing stuff like this, such as Urban Planning Aid, but it's a very small group of people. It's not very many people. With the Native people in Washington and Health Research Group, Sid Wolf, but there's not very many troops, not very many people who do it. No one's making any money off it, and everybody's terribly overworked. People just can't keep up with all the things they have to do because we're to the left of the money, and the big union support for the area really hasn't come down, in my opinion. This is what Assistant Secretary Ginter said.
Yeah.
There's no real union. The only union that's really interested is in the oil, chemical, and atomic workers, and of course they're having this shell strike on this issue. Mm-hmm. And one reason they're able to have a shell strike is because the level of consciousness has been raised in the workers through the activity of people like us. And for one reason that Tony Ozaki has supported the Chicago project, and one reason we did a course for them last December. Where we had about 25 people coming every week for 6 weeks at night, after work on Monday nights, was because he felt that MCHR, was an organization that had mobilized enough medical people who are interested in the issue, so there would be some follow-up. And there's, we've just a whole series of problems that we just haven't dealt with because, as I said, we just. It's like one half-time person.
Yeah.
We're turning stuff out. We've written up, for instance, a lot of. Manuals on how to do a project. We've done stuff on how to relate to union locals. We've done stuff on suggested collective bargaining demands. We've done critiques. I just did a critique of the Respiratory Disease Benefits Act, and we serve as a resource center for people that want to get work-oriented literature. We've probably gotten about 250 requests for literature through the mail, and stuff trickles in every week, and we fill those orders and send them out.
So you're primarily in the business of generating information.
Yeah, we can't do a service thing. We don't have any troops. There's no way. No one's going to give us money. No one has. We've written big, beautiful grants for different foundations. We spent a lot of time trying to get foundation money, and we didn't get anything. And we have very good relations with the people doing the. We're just not for the occupational health project. We just haven't gotten that kind of money. Now we sort of resigned to the fact that we're not going to get it, and but we'll keep the thing going somehow. And